All right, new at 10, it's enough to make you miserable, and we're talking about those pesky recurrent sinus problems, and we hear from so many of you who are just tired of all the pills and the sprays with no relief. All right, hold on here. We have found a treatment done right in a doctor's office, not in a hospital necessarily. Patients say it's allowing them to breathe again, infection-free, and Dr. Joe is here to tell you how it works.
For 25, 28 years.
Gary Rampino's battled sinus problems for just about a decade.
Get the sinus infection, take antibiotics, feel better, then it starts all over again.
Facial pain, loss of smell, even terrible earaches forced Gary into an endless cycle of temporary treatments.
How bad is it? From 1 to 10? I'm going to say a 7, but since May it's going to feel like it's a 12. That's enough.
See, all this gray indicates thickening of the lining of the sinuses.
Dr. Randall Latorre is Gary's ENT. He discovered Gary's sinuses are swollen and fluid can't drain.
Tell me if that's too
Today
much,
he'll make Gary's sinus openings bigger using a procedure once performed only in the operating room.
They walk into my office and they walk out of my office after the procedure.
Instead of putting Gary under with general anesthesia, he'll get pain pills and numbing medicine.
If it's too much, you just tell me and we can reposition some things just to make it comfortable, okay?
This animation from the company shows how it's done. Instead of sutures and scalpels, this inflatable balloon gently breaks the bones in the face, enlarging the passages that lead to the sinuses.
The bone is really eggshell thin, and so when you fracture that bone with the balloon system, it puts it into a permanent position and preserves the lining. This is a lighted seeker.
Dr. Latorre tracks from one sinus to another using a tiny camera and bright light. You can see it shining through Gary's face.
That without a doubt tells me I'm in his sinus that I just dilated.
Take a look. Here's the light before the procedure, and here it is after. You can see the difference in just how much farther the light can reach.
I was a little bit skeptical about it. Within probably 3 days, I was feeling great. I could smell and I could breathe through my nose.
Kara Madden had the procedure. She can breathe easier and no longer misses work.
I haven't had a sinus infection since I had it done. I have had a cold since then, and I was waiting for the sinus infection to come on. I haven't had it.
And there's the opening into the sinus there.
Results Gary hopes to experience.
John, this is a device right here. You can see here's the little light. It turns on, and then there's a balloon down here. It inflates. There's some fluid in here, and that inflates the balloon right there.
All right, Joe, here's what I want you to do. I want you to stick it right up there and fix my problem, because I think I've got the very thing you're talking about. I think we all have a problem with it.
A lot of us have,
sinus
really.
issues.
Yes, absolutely.
Well, what's the risk now, and how much does it cost you?
Like most surgeries, it can be bleeding, there can be infection, but you also have to be concerned because the sinuses are very close to a portion of the brain, so there can be perforation. That's why you really have to find somebody who's experienced not only in the OR, but also experienced in the office if you choose to go that route. Dr. Latorre said that the copay is sometimes as low as $20 to $60. But again, depends on your insurance. Most insurance companies do cover this, again, if you qualify.
All right, Joe, I want us to go over in the hallway, and you're going to do this over here in a few minutes.
No, I'm not one of those experienced people. You don't want me to do this.
Thank you very much. That's really interesting.